This animation shows how we can take bone from one area of the jaw and graft it to another. We begin by using a trephine drill to cut into the posterior part of the jaw. The bottom is then relieved with a disc drill. This piece of bone can then be separated from the jaw with an elevator. Note that the trephine fits perfectly around the bone burr. When the bone burr is used to prepare the recipient site, it will make the site fit the harvested bone that was created by the trephine drill. Small holes are made in the prepared site to allow for blood to flow into the area for faster healing. We can then make some final modifications to the bone graft itself to fit the site even better. Any sharp edges are smoothened and the corners are rounded. The graft is then positioned and secured into place with bone screws. Voids around the graft may be filled with some of the patient's own bone or various bone substitute materials to achieve smooth surfaces. The additional bone is compacted securely in the voids around the main graft. The dentist may also choose to cover the area with a collagen resorbable membrane to help with healing. It covers the entire grafted area. The flap is repositioned and sutured into place. During the healing phase, the patient may wear a transitional partial denture so that they do not need to be concerned about the loss of aesthetics during this waiting time. The sutures dissolve or they will be removed. The membrane under the gums will dissolve over time and help with healing by preventing soft tissue ingrowth. With time, the grafted bone will integrate or fuse with the recipient site bone as well as the bone fill. Once healed, we can access the area by raising a flap to remove the bone screws and begin the next phase of treatment. The holes created by the bone screws may be filled, and the bone can now be prepared for the implant fixture. In this case, a one-stage type of placement is demonstrated, where the healing cap is placed at the same time as the implant fixture. Once again, the patient can wear the provisional denture during this healing phase. The sutures dissolve or they will be removed. When the implant is ready, which is usually 4 to 6 months, it can be restored with a post and core and a crown as usual. Grafting using the patient's own bone allows the dentist to provide implants in areas where implants could not be possible.